Hi everyone, my name is Arlene and I'm Mona and Lisa's mom. Welcome to the episode 2 of Mona's Brain Tumor Diaries. In this video, I am going to share what happened after Mona's MRI confirmed the tumor and what we learned at our oncology appointment about radiation treatment options. Just a quick background, we had Mona's MRI on December 7, 2023, and that's when we got confirmation that Mona has a tumor located at the top of her spinal cord, around C1 to C3. And while we were waiting for our oncology appointment, the neurologist started Mona on prednisone. It was 20 milligrams once daily, as well as Gabapentin, 300 milligrams twice daily to help with nerve pain and inflammation. And I am not exaggerating when I say that the very next day, Mona was suddenly more active, almost like her puppy self again. She was also drinking a lot more water and had a huge appetite, which, as many pet parents know, can happen with prednisone. And even though those side effects were a lot, I was honestly just grateful to see her moving and happy again. And we were so happy that we could take her outside, back to her favorite park, going on little walks, enjoying fresh air. But even with prednisone, it didn't fix the neurological issues. You can still see it in her front paw weakness and knuckling. That part was heartbreaking because she wanted to do everything she used to, but her body wasn't fully cooperating. But still, Mona was so happy to run again, and she was always playing with her sister Lisa. And I have to say this, that these two are absolutely inseparable. Lisa stayed right next to Mona through all of it, and I truly believe that dogs can sense when something is wrong because Lisa just never left Mona's side. Mona oncology appointment was scheduled for December 18, 2023. And while we waited, I went to full research mode, reading, learning, and writing down every single questions I can think of. And I wanted to walk into the consult prepared because when it comes to your baby, you don't want to miss anything. And during those 10 days from December 7 to December 18, Mona also gained weight, which again can happen on prednisone. Then December 18 came. It was time for the oncology visit. During the consult, the oncologist explained that radiation therapy is meant to slow down or stop the tumor's growth and often shrink the tumor with a goal of improving Mona's comfort and quality of life, especially by reducing pain and keeping her neurologic function stable or hopefully improved. And they also explained something important and difficult to hear because the tumor is compressing the spinal cord. Radiation may not reverse neurological problems that are already present. And unlike surgery, radiation results are not instant. It can take weeks to months to see the full effect. They also told us that the risk and severity of side effects are best estimated after a CT scan and detailed treatment planning. And the goal is to keep the chance of a serious permanent spinal cord injury under 5% by carefully planning and limiting radiation exposure to healthy tissues. They explained the main radiation options like this. The first type was standard radiation. It's 20 sessions over 4 weeks, one treatment a day, 5 days a week. through the nearby tissues like the skin, GI tract, and spinal cord can be a concern, especially during treatment and in the month or two after. The second type of radiation was the IMRT, or the intensity modulated radiation therapy, also typically 20 sessions over 4 weeks, but it's shaped more precisely to better protect healthy tissues while still targeting the tumor. And the last type of radiation presented to us was the SRT, or the stereotactic radiation. It's more precise approach that's usually done in just a few sessions, and the goal is to deliver strong treatment to the tumor while protecting their surrounding tissue as much as possible, and fewer anesthesia events, which matters a lot to me. And they told us that even with radiation, Mona would likely still need ongoing medical management, like pain meds, such as steroids or gabapentin, and without radiation or surgery, the tumor would be expected to continue progressing over time. And this is the part that honestly crushed me again. Before radiation could even start, we needed a CT scan for planning, and that alone was almost $5,000. My heart dropped because we had just paid $6,000 for the MRI. And then I was told that the estimated radiation cost for IMRT is up to nearly $18,000. And the SRT is up to 14,000 US dollars. And we didn't have pet insurance. I remember thinking, how am I supposed to do this? Like, where will I find that kind of money? And then the guilt hit me, because the idea of choosing only palliative care and then losing Mona in that 3 to 6 months window, I couldn't handle the thought of not trying. So I started a GoFundMe, and it truly helped. We raised almost $4,000, which helped cover Mona's CT scan, but I was still facing the reality of the remaining cost, especially for the SRT treatment. So I made another difficult decision. I applied for 0% APR credit cards to try and to make it possible. And I know some of you or some people might not understand it, but I am not being honest. I will go above and beyond for my fur babies. I don't have kids. Mona is my child, and I'm going to fight for her the way any parent would. And if you want to follow Mona's journey, please like, comment, and subscribe, because it truly helps us reach people who might be going through something similar. And tell me in the comments, have you ever had to make a big medical decision for your pet? And in episode 3, I am going to share what happened when we started the next steps, the CT scan appointment, and Mona's SRT radiation treatments. Again, this is our personal experience and not medical advice. Please always consult your vet or specialist for diagnosis and treatment decisions. Thank you again for watching. From me and Mona.